Joining me now, Senator John Barrasso, a leading critic of the health care law. Senator, good to see you.
Thanks for having me, Jose. Thank you.
Thanks. In your Washington Times article, you say, and I'm going to quote, unless something dramatic happens, this may be the year of the health care law's collapse. Why this year? What are you basing that on?
Well, the Department of Health and Human Services says they're only expecting about half as many people to be signed up as they had originally projected. So we're still talking about 30 million people without insurance in the United States, in spite of all the president's promises, and fewer people are signing up because it's really not a good deal for them personally. The insurance being offered this year is worse than the insurance in the past in that it's more expensive, fewer choices, narrower networks. The co-pays and the deductibles are much higher, and that's why young, healthy people are refusing to sign up. So we're looking at even greater costs next year.
And Senator, let's talk about the big picture, because the Obama administration, of course, defending the health care law, saying that 17.6 million people got coverage, either because of the private plan, Medicaid expansion, or the ability to stay on their parents' plans. Almost 18 million people that didn't have access to health care. I mean, that's an extraordinary number. What do you say to that?
Well, number one is the president talks about coverage. He really doesn't talk about health care. I'm a doctor, practiced medicine for 25 years in Wyoming, and so much of this expansion is due to Medicaid, which pays doctors and hospitals so little that it's much harder for those patients to actually get an appointment to see a doctor. So there are a lot of better ways that we can do what we should be doing to try to get people actual care by letting states make the decisions. If they want to keep what's going on with Obamacare in California and New York, fine. But if in Wyoming and Texas we want to say, no, let us make our own decisions and get rid of the individual mandates, get rid of the employer mandates, we could do a much better job than Washington's one-size-fits-all.
Senator, what kind of a job could you do better when there are millions of people that have, for the first time in their lives, this possibility? So what would you do in Wyoming or other states that this law is not doing? What would you do better, I guess?
Sure. Number one is, I've had people in Wyoming lost their insurance coverage that worked for them when they could buy what worked for them, because the president said, no, it's not good enough for him. It wasn't good enough for the president. They had to buy much more expensive insurance covering things that they didn't want or need or could afford. So that's one part of it. And the Medicaid standpoint, I was in the Wyoming State Senate. We had much better ideas of how to actually keep the cost down and help more people than, again, Washington giving the dictate of what has to be done because of a one-size-fits-all approach. And remember, here we are 3 years into it. There are still over 30 million Americans without insurance. So when the president says it's working better than he expected, I can't imagine him saying there'd still be 30 million uninsured under his plan, and it is still extremely
that didn't have it
unpopular.
3 years ago.
It's still extremely unpopular all across the country, and people are saying, I can't afford it. It's too costly. It's too confusing. That's one of the problems with the health care law.
Senator, let's talk Syria now, because President Obama spoke to NBC's Lester Holt about this in an exclusive interview. Here's what the president said when asked whether he broke his promise about boots on the ground.
This is just an extension of what we were continuing to do. We are not putting U.S. troops on the front lines fighting firefights with ISIL. But I've been consistent throughout that we are not going to be fighting like we did in Iraq with battalions and occupations. That doesn't solve the problem.
Senator, you're on the Foreign Relations Committee. You voted against the use of U.S. military force in Syria. How does this change?
Well, the president's proposal a couple of years ago is what he described as a pinprick against Syria, and certainly I voted against a pinprick. The president drew a red line, which was crossed by Assad, and he ignored it. He said Assad must go. I will tell you, today Assad is stronger than he has been for years because Russia is now on the ground in Syria. I want to know what the president's strategy is in Syria. At the best, it's scattered, but I don't think that he can actually tell the American people what his strategy is. Now there are discussions going on with Secretary Kerry. We have Iran involved in those discussions. So many things are a surprise to President Obama. He was surprised with the invasion of Ukraine. He was surprised when Russia took over Crimea. He was surprised with Russian troops in Syria. I think that the president needs to come up with a strategy, explain it to the American people, and then get support behind him. But we're seeing this changing, shifting approach in tactics, but we don't know what his strategy is.
So would you support, do you support this change in strategy, call it what you will, 50 special operation people going into northern Syria, not being based there, but helping in the fight? Would you support that aspect?
I support a no-fly zone in a certain area of Syria so many of these refugees can go to that place to get aid, to get security, and from that location, they can then plan their next move. But when you take a look at how many troops and the numbers, we need a strategy from the president. You have bipartisan support for a no-fly zone in a section to provide some security in Syria, to provide help for the people. Assad has now killed over 250,000 people of his own country, and he is stronger now than ever with Russian fighters on the ground.
Senator John Barrasso, it's always a pleasure to see you. Thanks for your time.
Thanks for having me.